Hello everyone, welcome you all in our YouTube channel and in Radiology and start about today's topic. So today we will discuss on the topic barium enema. So watch the video till end and subscribe my channel for get a latest update or daily updates for our video. So let's start our today's topic of barium enema. Basically, barium enema is a radiographic examination of our large bowel by the administration of contrast media through the rectum. In this procedure, we use a barium and we inject barium through the rectum to the patient to examine the large bowel. This is the structures or images shown in your screen. This is a large intestine anatomy. In our large intestine, this is our ascending colon, this is our transverse colon, and this is our descending colon. This is sigmoid colon, and this is our rectum, and this is our appendix. This is a cecum. Appendix size is 9 cm, cecum is 6 cm, ascending colon is 15 cm, transverse colon is 50 cm, and descending colon is 25 cm, sigmoid is 40 cm, and rectum is 12 cm. This is the basic sizes of our large intestine. There are some characteristic features of our large intestine. Sorry, this slide not visualized clearly because I think like colored issue. Okay. Let's look over indication of our barium enema. Indications are like uncooperative or immobile or a very debilitated patient. When patients are immobile or uncooperative, they are very difficult to do the procedure. Another indication are like evaluate acute obstruction or valvulation in our bowel, reduction of the interceptions, which see the colon anatomy, or where only gross pathology excluded. Contraindications are like allergy due to barium suspension, or risk of perforation, peritonitis, acute fulminating ulcerative colitis, recent biopsy. So these are the conditions in which patient have a recent updates like barium suspension, allergy, risk perforation, patient have a perforation, or a patient have a inflammation in a peritoneum layer like called as a peritonitis. If a patient have a recent biopsy, then these are the contraindicated for the barium enema. Patient preparation for the barium enema. So firstly, prepare the patient with a low residue diet. Means we provide the patient low residue diet before 2 days before the procedure. No fatty fried foods provide the patient, or vegetables. Take plenty of clear fluids. Avoid iron containing medicines 2 days before the examination. Before 2 days, prior 2 days to examination, patient use low residue diet, no fatty fried foods, avoid iron containing medicine. We for a laxative preparation, we use a castor oil, means castor oil 30 ml for irritant cathartic. They are cheap, they have a dual action. In case of a biscuit oil, they use 15 to 20 mg. They have irritant cathartics. Also have a polyphenolic group, like example the dulcolax tablet present in the market, magnesium citrate, it's a saline type cathartics. Example are like picolax and a picosulfate, citric acid, magnesium oxide. These are also present in the market. For bowel wash, previous night bowel wash should be done 2 hours prior the procedure, or a previous night bowel bath will be done. Previous night's bowel bath, 2 hours prior bowel bath. Then tube inserted into rectosigmoid junction, 1.5 to 2 liter barium are injected. Then patient lies in a lateral, prone or a right lateral position. In department, we use dulcolax tablet 2 days before, tap water enema on a previous night, Means before previous night tap water enema is given, and 7 a.m. on the day of investigation. Low residue diet before 2 days. Same. Empty stomach on the day of examination. Preparation not done in a diarrhea. Totally obstruction. Paralytic ileus. Children less than 8 years of age. Also discuss indication and contraindication. Then is a single contrast technique, means we use low density 50 to 20% weight by volume barium suspension. Then after barium liquid is instilled into the large intestine through the anus, then tube near the rectum. This is the procedure. This is a technique. Patient like in a lateral position, lateral recombinant position. Then this is a barium tube, and this is connected to syringe through pipe or a tube through the rectum region, and these are radiographer to take a radiograph, and this is a pouch of a barium. Patient left lateral position, enema height not more than 1 meter, like this. Enema like this barium is not more than 1 liter. Then infusion started, infusion clamped. Then after splenic flexure, we also seen in the prone left side down oblique, hepatic flexure, also visualized in the prone right side down oblique, IC junction visualized in the supine right side up oblique, full film for an entire colon, post evacuation film for a polyposis diverticulosis. Pelvic outlet view for a rectum, means we use 30-degree cranial angulation with the patient in a supine so that the pubic symphysis and a sacral promontory overlap. For a pelvic inlet view for sigmoid, should be taken when transverse colon is fitted with barium, 30-degree caudal, tilt with patient in a supine position. These are barium enema radiograph. Indication for a double contrast technique of barium enema. Indication like preferred method of routine examination, high risk patient, demonstration of sinus and fistula, patient with a severe diverticula, polyposis, or diarrhea, presence of obstruction. In case of contraindication, patient is debilitated, unconscious, or inability to cooperate, then we use double contrast technique. In double contrast technique, plenary film is used. Plenary film is taken for assess of abnormality of a gas-filled bowel loop. Barium enema done after excretory urogram. It gives a relationship of the system to the colon, which will help in a visualization of a bladder in frontal and a lateral projection. And they also permit the study of the space between urinary bladder and the rectum. We use high density barium in 75% to 95% weight by volume. Then patient is kept in a prone position with left side down oblique, and a barium suspension is introduced. When the barium is seen to reach the mid transverse colon, splenic flexure air is pushed. Means when the barium reach to splenic flexure or a mid transverse colon, then we push the air through the rectal tube. Then after, air should be pushed to the barium colon and never pass beyond the colon. Then patient take back in a prone position with right side dependent, and air is pumped into the left side up position. The different position, like when we take image for a rectum and a presacral space, then patient should be in a left lateral or a frontal prone. If we need a part of a wall, we patient in a DCBE position. If we need a rectosigmoid, patient should be in a prone side up oblique, prone left side up oblique for a left splenic flexure, prone right side up oblique for a hepatic flexure. For supine, we get an entire colon image. Then this is a rectosigmoid junction. This is splenic flexure image. Double contrast study have advantages like it's for better surface detail, and a surface lesion can be easily demonstrated. They are easy and revealing of the colon. In disadvantage, they are very difficult to uncooperative patient. Fistula sinus can be missed. Effacement of the submucosal details. These are the images for our barium enema. Note, there are some note like a colon repeatedly given. gives contraction, Buscopan 1 ml per IV. Patient does not retain barium, like make patient prone, distend the colon slowly. If there is a sphincter incompetence, then strap the buttock with sticking plaster. Use Foley catheter, big balloon. Patient with total obstruction, then evacuate part of the barium, pump air. Froth goes through the obstruction. The proximal limit of the obstruction can be demonstrated. Absolute contraindication for SCB and DCB means single contrast barium enema and double contrast barium enema, like toxic megacolon, pseudomembranous colitis, rectal biopsy done 5 days, paralytic ileus, difficulty to pass barium in the rectum, inflamed piles or growth. Special barium enema studies like sigmoid flush and instant barium enema. These are colostomy enema images, and after the barium motion will be white, ball motion will be white. Laxative should be used to avoid barium impaction. Complications are like preparation of patient, pharmacological agent, procedure like perforation, inspiration, causative colitis, transient bacteremia. Pharmacological agent we use a Buscopan. And thank you. Like the video, comment on the video, subscribe the channel. Thank you. We will meet in the next video. Till then, bye bye, take care.